Hello, I'm Bozada. I'm here at Hosmer Chiropractic Health today. We're going to discuss some mobility and stretching techniques for the biceps, the brachialis, and the brachioradialis. So just to briefly kind of explain those functions of the muscles, the biceps and the brachioradialis are muscles that are really fundamental in pronation and supination of the wrist and forearm, which means they mostly attach to the radius, which is the muscle of the bone of the forearm that rotates over the ulna, which is the static bone that does not move in the forearm. The brachialis is a muscle that attaches at the middle of the humerus and goes onto the ulna, which is, again, the foundational bone in the arm that does not rotate or move at all. So in essence, the brachialis is the muscle that's the only true elbow flexor, as it only attaches to the stationary bones here. The other two, brachioradialis and the bicep, attach to the radius. So sometimes issues in the brachialis are the true cause of what comes off as a bicep issue. So we're going to kind of address getting that deeper muscle with a few techniques. So the first one, we're going to be on a barbell in a lying position. And we're going to raise the barbell, get the arm that we're going to treat underneath the top of the barbell here. And what we're going to do is, this is very intense, so we're just going to slowly kind of apply some pressure along the fiber lines here in the bicep. By doing this, we're also getting to the brachialis, which is deep to the bicep. And so we're just going back and forth here. If we want to add a little bit of lateral cross fiber action, what we'll do is we'll just start to rotate the wrist here as we go down with the barbell. And then we reset it, we turn that thumb over. And again, this is effective because the biceps and the brachioradialis are fundamental in that pronation and supination of the wrist. So we want to make sure that we're doing that while we're doing the massage techniques. You can also pin down a point that tends to be worse than other areas of the belly of the muscle, and then perform the rotation and supination here while under pressure. Another thing we can do is find a spot along here, raise and twist, lower and twist, raise and twist, lower and twist. Okay? If we want to get into more brachioradialis, we'll turn over a little bit. We'll get right on that muscle, which is in between the bicep and the tricep, and we'll roll through it. You'll feel it. It's a very small area next to the elbow, and we'll go all the way into the forearm. Again, we can statically place pressure and move the forearm around with the wrist. Right on the joint orientation here of the elbow, and the olecranon joint is very tender. So you want to make sure that you apply the pressure and twist only as far as you're comfortable with. Okay, from there, we're going to move into 3 other variations. Okay, so now we're progressing to another variation of bicep brachialis and brachioradialis stretches and massage techniques. So in this one, we're going to be seated on a medicine ball or something that's lower than our platform. We're going to place a kettlebell with the handle up on top of the box. And essentially what we're going to do is we're going to have the biceps brachialis and brachioradialis, which is again on the anterior side here, right on top of that handle. And so we're going to apply those same foundational techniques of rotating the wrist, which is the function of the brachioradialis and the biceps, while under tension and under pressure here. And then we can also rotate further onto the brachialis and apply the same principles in flexion extension of the elbow. So you can do this from the seated position, and we can also add a band onto the shoulders. You might want to double up the pressure, and what this will do is depress the shoulder and upper body down into the kettlebell, adding pressure into the stretch. So from here, we get our kettlebell in a good position. We rotate, flex, and extend, depending on where your issues are. The more we rotate over, the more we get into brachialis. Okay, the more forward we are, the more we're into the belly of the bicep. Okay, and we're just going to kind of work through all that tissue with this band kind of cueing us to keep the body weight down. Okay, so now we're going to progress to a standing variation with a barbell like in the first position I showed you, or in the first scenario I showed you. This can have a band application, just like the previous one we just went through, where we're going to kind of load up the shoulder girdle and keep some weight down on the upper body. You can start out just by having the bicep over the bar, rotate the shoulder down and in, and we're going to be able to get right on that bicep. You can kind of keep the bar steady so you can kind of roll through. You can also internally, externally rotate on the bicep, get some of the tricep in there as well. And again, that brachialis is more in between the bicep tricep on the side lateral aspect of the arm. So to get that, we need to be a little more internally rotated, chest away from the bar, and flex and extend that olecranon elbow joint. Another way to do this to intensify it is to step on a band, load up the shoulder girdle on the side that we're treating, and from here what this will do is depress the shoulder down. We're going to totally let that do so and continue to roll through that tissue based on what we need. Okay, so supination, pronation of the wrist, internal and external rotation of the shoulder while on this pressure. Okay, in the fourth and final variation technique here, I'm going to show you how to use the TheraBand flex bar or whatever else you have that could apply for this situation to kind of create some joint space here in the back of the olecranon elbow joint. Kind of just provides a little bit of joint distraction in here while also statically depressing the biceps, brachialis, and brachioradialis in here, kind of providing some therapy as well. So we're going to place the flex bar deep in the elbow joint. We're going to flex backward almost in a front rack position. We're going to get a back squat grip on the bar, and we're going to step back, and from here we're going to draw the elbows in and let the bar roll down the back of the shoulders. From here we have internal, external rotation of the shoulders that we can work. We also have some height that we can work with on the elbows, rotation of the shoulders, and we can also wrist curl, which starts to work those muscles dynamically as well. Okay, so you just want to keep the core tight, hips underneath you, while you're running through all these variations. Afterward, we just place the bar down, and you can feel a pretty quick difference in that elbow joint. This is also very good for the front rack position of the clean. We hope this helps you. Enjoy.